The following program is made possible by Wells Fargo. Wells Fargo, the next stage.
We are all alarmed and deeply troubled by the seeming increase in deaths by suicide in our community, especially among young people. We talk with a Peninsula mental health services expert to ask why and what we can do. The game is on. I'm Mark Simon. Welcome to the game. Is our community emotionally unhealthy? Are the stresses of our modern urban lives, the pressures to succeed, the very nature of life in our community, causing an increase in mental and emotional problems and death by suicide? We consider these complex and difficult questions with Stephen Kaplan, Director of Behavioral Health and Recovery Services in San Mateo County. Thanks for being with us. I appreciate it.
Thanks for having me.
A lot of loaded questions at the beginning there. Let's start with the seeming increase in deaths by suicide, because there's been a lot of attention. We should disclose on the show, for full disclosure, that I work for Caltrain. We've had a terrible start to the year in terms of the number we've had, and that's generated a huge amount of media and community attention. So that with it comes a sense that we're in a crisis, that there's some surge in this problem. Is there, or is it historically pretty much what it's always been?
When we look back several years, as back as 5 to 10 years, and look at the pattern of suicide, the actual rates, it looks pretty consistent. I think what happens is when we get clusters of suicide, in other words, in short periods of time, it makes it feel like we have a spike and an increase. But the data would say it's pretty constant over a longer period of time.
Is our community healthy as it should be? I mean, everybody's aware of all the stresses, the cost of housing, the drive to succeed. A lot of our kids are really being pressured to achieve at the highest possible level, at a national level. Are there things as a mental health professional that you're concerned about, sort of the nature of our community and whether or not it's as healthy as it needs to be?
Well, I'd first say nobody's as healthy as they need to be. There's always room for improvement individually and collectively. There are some things that are concerning. I think overall this county does pretty well, although you have to be careful not to generalize too much, because we have populations that experience life very differently in this county. There's a pretty growing income disparity gap that's existing in this county. We know there are many, many families and their children that are really struggling to just kind of make it through the everyday life. So we're concerned about that. We're also concerned of the pressures that young people are experiencing and what healthy outlets that they have in their lives, so that these pressures can be dealt with in a healthy, constructive way, as opposed to taking a path of using substances or looking at potential suicide. We have some concern. The county has a youth commission that every year does a survey, and one of the things they focused on this year was kind of the emotional health of students in the county. They got a pretty good response, and we were concerned by some of the things that came out of that survey in terms of how stressful students feel their lives are, and how many kids are actually thinking about suicide as a potential solution to their problem. Fortunately, not many act on it, but it is enough to really give us some pause to think about what we're doing to intervene and provide support to kids.
Give me a flavor for what are the stresses in a high school student's life, because I'm old enough to not remember much about high school, but I don't remember being particularly stressful, except on the days when there was a test I had not prepared for. But what are we talking about? What's happened that's changed the nature of the lives of these kids?
Yeah, I'm like you, similar kind of recollection. Number of things. I think there's a lot of competition to succeed. So there's pressure just academically for many, many populations. We, in fact, we're working with one of the high schools in the county who were starting to see many kids experiencing stress, and they were actually calling for psych emergency services, which was a real different experience. And when we started working with that campus, there was really high expectations on kids to achieve. So we've been working with the school to help parents kind of think about things a little bit differently. So that's one example. I think the social media is a totally different experience than you and I had. And I think that plays out both negatively and positively for kids in terms of the pressure and the peer pressure and what's out there for public consumption that when we were in school just wasn't out there for public consumption.
Well, that's an interesting point too, is that if you're having a hard time with somebody at school, in our generation, you can go home and that person's not around, but now you go home and that person may be rallying 20 people to keep picking on you all night long.
Yeah, and we had a recent, the pretty public case about some harassment that occurred online. A young girl took her life, and that's been in court, and there's been a recent settlement. But not that that's the norm, but I think that's kind of indicative of some of the pressures that kids face.
What kind of pressure are parents under? I mean, in another show just recently, we talked at length about the cost of housing, what percentage of your income has to go to that. If the kids are being pressured to succeed at a high level, it's probably coming from the house, right? The home, isn't it?
Yeah, and again, it plays out differently in different households. Generalizations are a little bit, I'm always a little bit leery of it, but again, in the county, we have families that are just barely making it and working several jobs and having multiple families living in the same home, and all of that just adds tremendous stress to the family unit and to any of the kids in the family.
Let's talk a little bit about, in a more general sort of data-driven point, about the rates of mental illness and death by suicide in this county. It hasn't changed much, and I guess in some ways that's good news, and that it hasn't gone up, but on the other hand, in the line of work you're in, you'd probably like to see those numbers going down. Is there a particular series of illnesses or kinds of illnesses that are showing up consistently, and are they reflective of the stresses we're talking about, or is there something else behind this?
Again, when you look at the data, the general population doesn't actually change that much. The prevalence data around mental health issues amongst kids are pretty consistent. We know that when you look at a population, San Mateo, the state, the country, around 20% of kids would have some sort of diagnosable mental health condition, some very significant and severe, some less so. So that's pretty constant. We know that suicide is the third leading cause of death for young people in this country. So that's obviously a big concern. So the data doesn't really change. I think what changes is the resources that might be or not be available, how kids and their families survive and respond to those same kinds of stressors, but the actual prevalence has not particularly changed.
Let's talk specifically about teen suicide. We were talking before about the stresses on them. I read somewhere, I have no idea if it's accurate, must have been on the internet, so it must be true, that a huge percentage of teenagers in particular who choose to kill themselves through suicide have an underlying mental illness. It may be undiagnosed, but nonetheless it's there. Is that true?
Yeah, I think there's definitely, again, on the spectrum of potential diagnoses, yes, I think that's true. That obviously there's something that's been happening in that person's life that's causing them enough distress that if we were able to intervene and meet with that child, likely they would have some underlying mental health condition.
We're going to take a break, and we're going to come back and continue to talk about this important topic. Stay with us.
It's been over 150 years since Wells Fargo first opened for business. Since then, we've enjoyed your community support, and we're passionate about returning it. Every day, Wells Fargo team members roll up their sleeves and donate their time to organizations and charitable groups throughout the Bay Area. Nationally, we've committed even more. In just the past 2 years alone, we've donated over $70 million to support schools and educational programs. It's a commitment we're proud of. Wells Fargo, the next stage.
Welcome back to The Game. I'm Mark Simon. We have Stephen Kaplan here, who is the Director of Behavioral Health Services and recovery services in San Mateo County, and we're talking about the difficult issue of the mental health and well-being of our community. It seems to me that one of the issues that is central to having an impact on these numbers, we were talking off the air, I work for Caltrain. We average over a 10-year period 12 suicides a year on the right-of-way, but the 3 counties we serve average 300. And so the issue really seems to me trying to attack the larger number, attack the underlying problem. So much of it seems to be whether or not people can find it within themselves to say, I need help. And I would imagine, is that a huge part of what matters to you and is an essential component of your ability to succeed with people?
Yeah, it's an interesting question because I think part of people's willingness to say I need help has to do with the social environment that they are living in and whether that's an okay thing to say. So this is an important issue for us around the stigma of mental health issues in this county and every county everywhere. And how stigma plays out, which is basically that if somebody identifies themselves as having a mental health challenge, problem, issue, that somehow they are going to be looked down as having something wrong with them that they should be ashamed of or they should hide. And we know that in this country as well as in this county that many people do not seek treatment. So they don't say I need help because of the fear of being stigmatized in their families, among their peers, at school, in the community. And until we really address this as a community and society that says a mental health challenge is like a physical health challenge. You have a broken leg, you don't hide your broken leg because you think somebody's going to think there's something wrong with you as a person. We're not there yet on mental health issues, so I think a lot of people stay silent and they suffer silently because that's a greater fear than the suffering that they're experiencing. We spend a lot of time trying to deal with issues of stigma, and we want to talk about it as much as possible, because when we deal with that and that becomes less of a factor, more people are going to say, I'm struggling, I need help, I want help, come help me.
Yeah. Well, how do you do that? How do you lift the stigma? You can't simply start saying to people, it's okay.
Yeah.
It's not that simple, is it?
No, it's not. And this, again, plays out very differently in different cultures. And there's some real myths and beliefs about somebody that has a mental health challenge and where that comes from and what that says about the person. So in many ways, you have to really have that conversation with the context of a specific culture.
Can you give me some examples of cultural differences?
Sure. In Chinese culture, and obviously I'm not a Chinese American, they have some very different beliefs about where mental health issues come from and what that says about the person, and then how you can actually talk in that culture so that you can actually move a person to get the kind of help. You just have to understand those nuances. One of the things that is really effective for us is we have many people who have had mental health challenges and have been in treatment speak out about their life experience to show the community that I'm a contributing member of this community. I have a mental health issue. I'm not ashamed of the issue. I've sought treatment. It's helped me, and here I am to talk about what we call lived experience. We do a lot of that in this county, and we try to do as much of it as possible. And the other is to provide data and information to the community that mental health challenges isn't segmented to a specific population. Probably every family in this county could trace somebody in their family that had a mental health challenge. Mm-hmm. Now, they may not have known it at the time, and it may have been hidden, but it's pretty easy to do this 6 degrees of separation, and you'll find somebody in your family.
So, what do you say to people? I mean, how do you tell people it's okay to speak up? There's help. There's hope. Don't be afraid.
Well, again, it's a multiple kind of pronged approach. And what we have found is when they hear somebody like them speak about that experience, it opens up a tremendous floodgate of that's okay for me now. I didn't know it was okay because I never saw anybody like me say it was okay and tell me I had a similar experience. That's very powerful. Working with other key adult allies, if we're talking specifically about children, where they're understanding and sensitive about the challenges that kids are going through, so that a youth could say, I have a problem, but I have an adult ally that I feel will support me and will not condemn me for speaking out.
So essentially what it requires is someone they can turn to, who can say, I understand what you're going through, I've been through it myself, or I'm your parent, I understand what you're going through, and I'm here to help you.
Exactly.
How hard is that how big a task is that?
It's big. Stigma is it's almost insidious. You don't really necessarily see it. People experience, but it's not like, you walk down the street and you see a sign that says stigma zone. It's just, it's pervasive, and to me it's about the conversation, continuing to talk about it, and I talk about it whenever I can, because without it staying in the forefront, it just gets pushed in the background, and I think the results speak for themselves.
Are you tracking that sort of data? Is there any sort of increase that you've noticed in the number of people who are stepping up and saying, yeah, I need some help now?
It's hard for us locally to quantify that. There's some work that's being done at the state level. There's an organization that's been doing a lot of statewide stigma reduction work, and they actually are working with the RAND Corporation to see how things are actually changing. There's some work been done at the state level for a few years, and they're actually seeing some changes in community attitude about this. So it's kind of a unfolding kind of process. So if we believe that the community attitudes around stigma start to change, where people are more understanding, accepting, we will see an uptick in the number of people that are seeking treatment.
Well, it's a good place to take a break. Well, don't go away. And you stay with us. We'll be right back.
It's been over 150 years since Wells Fargo first opened for business. Since then, we've enjoyed your community support, and we're passionate about returning it. Every day, Wells Fargo team members roll up their sleeves and donate their time to organizations and charitable groups throughout the Bay Area. Nationally, we've committed even more. In just the past 2 years alone, we've donated over $70 million to support schools and educational programs. It's a commitment we're proud of. Wells Fargo, the next stage.
Welcome back to the game. I'm Mark Simon. We're joined by Stephen Kaplan, who is the Executive Director of Behavioral Health and Recovery Services for San Mateo County, talking about the issue of the mental well-being, mental health and well-being of our community. May is Mental Health Month, and there are a bunch of activities you guys have planned. We have a flyer. Garrett, maybe you can put that flyer up now to show us some of the activities that are going on around the county. What's the theme of this? Is it pretty much what we've been talking about, is to just simply get the community talking about this in a way that gets people to say, okay, I can go get help?
Exactly. So why do you have a month devoted to mental health? It's really to raise awareness about mental health, that it's in our mental health challenges are experienced by people in our community. Our community is no different in that respect than any other community. We want people to be aware of it. We want people to understand and get interested in it. And as I was speaking before the break around the issue of stigma, this is another effort to really address the issues of stigma and acceptance of people with mental health challenges.
Is there a website people can go to find out about this?
It should be on the flyer.
Yeah.
If you ask me
I can't
what
find
the
it on
website
here.
is.
But if you go to the county website and type in mental wellness or Mental Health Month, they'll find it. The other thing we have, I was in a meeting you spoke to not too long ago and talked about some of the resources you're providing to families. It got me very excited because of the kind of conversation we're having. And we have that up as well. It's a mental health emergency brochure. I think you had that up earlier, Garrett, so maybe you can put it back up again. And you can talk a little bit about what these are intended to do, because it looks like it's very practical. It gives people, well, you tell us what it gives people.
Sometimes family members need to call 911 because of some of the emergencies that are happening in their families that are due to somebody that's having a psychiatric crisis. And they call 911 and they call dispatch, and then a response is then created. What we wanted to do was to give family members and those who are supporting people that may be experiencing psychiatric crisis to be prepared for it, to really be prepared before it happens, and in the event that it happens, what they can do to be most effective in order to get the best help for their loved one at that particular time. So it's a guideline, and it's also a script. We've scripted out for families. When you call 911, here's the script that we want you to use to communicate with dispatch. In the preparation of this, we talked with the dispatchers in the county to get their feedback on what would be helpful if they received these calls. And we worked with family members in the creation of this information, so we really were sensitive to their issues as well as dispatch. And we've had an amazing response to this. Our first order of these materials was 15,000. We burned through that in like really quick, and now we're into our second orders, plus it's online.
Yeah. The other thing you provided is what is entitled the Youth and Young Adults Emergency Crisis Resource Guide. And this is sort of at the other end, is even before a crisis. It's also like the early warning signals, it looks like to me,
right,
of
exactly.
somebody who's becoming troubled. And I guess it's the combination you're looking for of that kind of information, and then what do you do about it? Tell me what kinds of things are on here, and how do you distinguish, especially among young people, between that kind of behavior and
just
sort of normal
behavior,
teenage
yeah.
angst? I mean, there's going to be a fair amount of drama in any home with somebody who's a teenager.
This guide, we broke it down in age categories because we didn't want to overgeneralize. And you're right, what we've tried to do is pick some behaviors that people just should be aware of. And of course, some of it is in the realm of normal behavior, right? But what we're trying to do is create an attention to when your particular child moves off of what they normally do. And to be responsive to that in a way that you can be helpful as early as possible. The family script is when things have gone really kind of wrong in many respects, and the earlier we can intervene, the better. And we're providing that to parents, and we're doing some things on school campuses as well to try to locate and identify young people very early in the process to get them help that they need.
Well, what's interesting too about the Emergency Crisis Resource Guide is it has a list of behaviors, but then it has a list of resources and steps you can take. And I would think there are two elements of this from a parental point of view. One is, what am I supposed to do? I've got a kid who's starting to spin out of control. And you tend to want to think as a parent, I can solve this, I can fix this. You want to be that to your child. But second of all, talking about stigma, I mean, I would imagine that 911 call can be very, very hard for people to make.
Very hard for them to make.
Yeah.
Yep.
And so how much of the emphasis on lifting the stigma has to be focused on not necessarily the person who's in crisis, but the person who's trying to help that person? Like a parent saying, I can imagine it's hard not to feel like you failed somehow.
Exactly. And that's the dynamic we have to change, and because we know everybody goes through struggles at different points of their lives and need different kind of support and assistance. And ideally, we should be in a place in our community where it's never, you should never feel that you have failed, but that you've recognized that your son or daughter is struggling with something and you're going to get the help that they need.
So there is, I want to specifically mention Mental Health Month. The program is called Stand Up for Mental Wellness. And Monday, May 4th from 6 to 8 p.m. in San Mateo are going to be some people telling some stories. What kind of stories are they going to be telling, Steve?
They're going to tell their stories about living with a mental health diagnosis and what that's meant in their lives, and the good, the struggles, the bad, and how that's impacted their lives. As I was mentioning earlier, the power of somebody who's kind of gone through that is really important for the work.
And that's free. It's Monday, May 4th, 6 to 8 p.m. How do we have an impact? I mean, you know, because of my job, I come across this issue from time to time, but as sort of a normal person in a normal day of life, how can you have an impact on this troubling problem?
Well, one is I want to thank you for this. This has an impact. Really creating a community dialogue around the issue is extremely important to the overall effort. I think the other is become educated, find out more as much as possible. Don't be afraid. Help is available. Recognize if you or a family member or somebody you care about you feel is struggling, don't be afraid to talk with them and see what help you can give them. Denial is not our friend. Denial doesn't make the problems go away. They just delay them.
We're going to have to stop there. Stephen Kaplan, thank you for joining us and talking about this really difficult and important subject. And thank you for watching us, and join us next time on The Game.